I'm a psychiatrist in San Francisco with a mostly psychotherapy practice. I was a psychotherapy researcher early in my career, and for decades I've taught psychiatry residents, that is, doctors specializing in psychiatry, about psychotherapy. I've also known and worked with many health professionals over the course of my career, and in this video I'll review the types of therapists and other related mental health professionals so you can make a more informed choice about whom you might want to work with. I'm Dr. Stephen Reidbord, and this is More Than Meds, where I talk about psychotherapy and psychologically informed psychiatry. Many years ago, I wrote that choosing a therapist or psychotherapist is like choosing a mattress. Every store has its own house brand, so it's almost impossible to find the same product in a different store. Likewise, you can't really tell what kind of therapist you're getting solely by the label, by the degree after their name. Briefly trying a mattress in the store or just interviewing a therapist for the first time doesn't really tell you too much about how it's going to work out long term, about the comfort or support. The fit for mattresses and therapists is very personal and subjective, so you can't get too many clues from friends or from online reviews. They can't tell you that much. And it's an expensive long-term investment, so if you make a mistake with a mattress or a therapist, it can be costly and really regrettable. The analogy doesn't stop there. I'll torture it for another minute here. Will you select a firm mattress that's good long-term for your back, or a soft one that feels good in the moment? Likewise, a therapist who's a little tougher on you, or one that's kind of a cream puff that'll just be supportive and validating, but not really help you change anything. Is it smart to choose the least expensive model or to pay more for more quality? And finally, is this a mattress or therapist just for you? Or will you be sharing it with a partner, for example, in couples therapy? Okay, I'm done with mattresses, but there's a bewildering number of therapists out there with different degrees after their name, different levels of training, and they present themselves as offering different kinds of therapy. I can't advise you about which mattress to buy or which therapist to see, but I can help you ask the right questions. The first thing to know is that the name therapist or psychotherapist really means nothing legally or in terms of training. At least here in California, and I think in other states as well, a person can call themselves a psychotherapist or a therapist with no training whatsoever. There's no standards for being a therapist per se. Now, in contrast, being a social worker, being a psychologist, being a psychiatrist, those all have very specific requirements and educational standards, and it means something. So when you are looking for a therapist, it's important to take note of what kind you're looking at. I also want to say here that in other videos, I've made kind of a big point of differentiating, distinguishing therapy and psychotherapy. Therapy is a kind of generic, sloppier term that's used nowadays, and it includes a lot more things than what we normally and traditionally have thought of as psychotherapy. I talk about it in this video here. But just to make things easier, I'm going to talk about therapy in this video. So let's start with level of education or level of training. By the numbers, most therapists are master's level trained. And that includes licensed clinical social workers, marital and family therapists, and also psychiatric nurse practitioners who also have master's degrees. In contrast, most psychologists and all psychiatrists have doctorate degrees, mental health specialty training for at least 4 years. It's important to remember, though, that most mental health professionals with any of these degrees often go on to do additional training after they've gotten their licenses. So for example, any of the people that I've just mentioned, clinical social workers, marital and family therapists, psychologists, psychiatrists, can go on to get psychoanalytic training, which is a separate thing. And it can go on for years and be a very intensive training. It also includes getting one's own psychoanalysis. And so You don't really know just by the letters after a person's name how much training they've had. It tells you something, but it really doesn't tell you everything. Now let's turn to treatment approaches. And here I'll need to generalize. And of course, there's always exceptions to generalizations. But speaking generally, the master's level therapists, the psychiatric social workers, the marital and family therapists, tend to think in terms of interpersonal relationships and social systems, the way people relate to each other. They look at family systems and typical roles that are played in families and other social groups, whether one person's being scapegoated, whether someone is trying to attract others' attention, or if there's a shared family secret, say. There's relatively less attention paid to unconscious dynamic processes or dysfunctional cognitions and pathogenic beliefs, the kinds of things that CBT therapists focus on, although this isn't universally true, of course. Such therapists may be particularly skilled at working with couples and families, and they're often the most knowledgeable about public agencies and social resources, things like shelters and halfway houses, and job training, and so on. When we talk about psychologists, we have to first make a distinction between academic psychologists, that is, psychologists who work in universities and they teach psychology to the college students, they do research, they publish academic papers, they study the scholarship of psychology, versus clinical psychologists, and that's what we'll talk about here. Those are our psychologists who treat clients or patients. Clinical psychologists are uniquely trained to administer and interpret psychological testing, like IQ testing, personality testing, Rorschach ink blot testing, and so forth. Doctoral level psychologists, that is, those with a PhD after their name, or a PsyD, P-S-Y-D, is also a doctoral level psychologist. They have the most psychotherapy training of any mental health professional, including psychiatrists. The PhDs also receive quite a lot of research experience in their training. Psychologists can be found who offer the full range of different kinds of psychotherapy, often for all ages, and many offer couples therapy as well. Psychiatrists are physicians, usually MDs, who specialize in psychiatry, much the same way that dermatologists specialize in skin diseases or cardiologists specialize in heart disease. Psychiatrists sort of famously can prescribe medications, as can psychiatric nurse practitioners in many states. And we're also the best trained and equipped to differentiate medical problems that only look psychiatric. There's actually quite an overlap between problems that are medical diseases that have psychiatric signs and symptoms, and also occasionally psychiatric problems that look medical. Child psychiatrists have extra training, so adult psychiatrists, like myself, for example, don't treat children, just adults. And there's also specialty training in psychiatry for geriatric psychiatry, addiction psychiatry, and so forth. Traditionally, psychiatrists emphasize psychoanalytically derived therapy, like the psychodynamic therapy I talk a lot about on this channel. But that's changed quite a lot in the past 40 or 50 years, quite a long time now, with a gradual de-emphasis in providing any psychotherapy at all. In America, most psychiatrists mostly prescribe medication, although they do sometimes offer psychotherapy to a limited number of patients. Those of us who still offer in-depth psychotherapy as the main part of our practice, in addition to or sometimes instead of medication management, are mostly found in the large urban areas in the United States, New York, LA, Chicago, San Francisco, Boston, and so forth. The rest of the country, not so much. It's also not uncommon to see a physician or nurse practitioner for medication management and to see someone else for therapy. That's what we call split treatment. There isn't anything inherently wrong with it. Often it's more economical. There is an argument also for seeing a psychiatrist for both medications and psychotherapy, so you don't need to see two different people, and also there's some advantages in integrating both parts of the treatment. So I've described these groups from the largest number, the master's level social workers and marital and family therapists. They greatly outnumber the number of psychologists, who in turn greatly outnumber the number of psychiatrists. Also, the cost to see these people, the fee, tends to go up in the same order. There are also folks you can talk to for money who aren't therapists or psychotherapists, strictly speaking, but they're therapy adjacent. I've heard a lot of debate about whether counseling and therapy are the same thing or different. And I think that question is harder to answer if you're using the term therapy, because therapy itself is such a kind of generic and wide-ranging term, such that I think there is a lot of overlap between counseling and therapy. But if you talk more specifically about psychotherapy, I think there's a pretty clear distinction. Counseling really doesn't aim to change a person internally, to change their psychology. It's really more towards helping a person fit better with their environment, with what's going on around them. And therefore, there are job counselors and educational counselors to help a person find the right path, not necessarily to change so much inside. I should also mention that there is somatic therapy. There's a large number of practitioners, massage therapists, and others who do help people emotionally, but they do so not so much through talking, what we normally think of as talk therapy, but through bodily manipulation and so on. And then there's coaches. That's become a much more popular job title in recent years. Coaching is sort of adjacent to therapy, or actually more adjacent to counseling, I would say. There are no legal standards about what constitutes a coach. You can call yourself a coach just like you can call yourself a therapist without any kind of degree or training at all. Although there are certificates that document that some coaches, at least, have gone through a training program to learn how to do it well. Coaching has mostly framed its area as helping people to kind of optimize their functioning when they're already doing pretty well. And so it's not as much of a treatment for a problem, but a kind of extra thing that you can do to perform better. And then there's pastoral counseling, where pastors and priests, other religious figures offer counseling from a religious perspective. They generally do have some training in counseling, and clearly in that context of a religious tradition can be very comforting and supportive. I'll close by mentioning that you may not realize it, but the great majority of psychiatric medications are not prescribed by mental health professionals at all, certainly not by psychiatrists, by primary care doctors, by pediatricians with kids, by not psychiatric nurse practitioners, but by primary care nurse practitioners. Even though psychiatrists are mostly identified with prescribing psychiatric medications, we actually don't prescribe most psychiatric medications. And so in a kind of ironic way, a lot of mental health care in this country is provided by people who are not mental health professionals at all. Well, that's it for this time. I hope this whirlwind tour has been helpful. Please let me know in the comments what you think, and also if I left anybody out or misrepresented anyone. I certainly hope not. Please like this video, but only if you really like it. Please subscribe if you have not already. And if you like this video, the YouTube algorithm tells me that you will very likely enjoy this one as well. Thanks, and till next time.